1. A pear-shaped radiolucency causing displacement of the roots of vital maxillary lateral and cuspid teeth is characteristics of A. Globulomaxillary cyst, B. Apical periodontal cyst, C. Primordial cyst, D. Nasoalveolar cyst, E. Lateral periodontal cyst. Option A is correct. 2. Lesion that characteristically occurs on the alveolar ridges of infants is A. Congenital lymphangioma, B. Fordyce granules, C. Bons nodules, D. White sponge never, C. Retrocuspid papilla. Option C is correct. Bons nodule. 3. Features of familial multiple neurofibroma with caffeolate spots of the skin are typical of A. Von Reckling-Orson's disease of skin, B. Pigot's disease of skin, C. Hereditary ectodermal dysplasia, D. Familial fibrous dysplasia, E. Papillon-Lefevre syndrome. Option A is correct. Von Reckling-Orson diseases of skin. 4. The chemical disintegration of enamel is referred to as A. Abrasion, B. Attrition, C. Erosion, D. Hypoplasia, E. Pitting. Option C is correct. Erosion. 5. Mottled enamel is produced by A. Syphilis, B. Febrile diseases, C. Fluorine, D. Acids, E. Tuberculosis. Option C is correct. Fluorine. 6. The structures of enamel that are more resistant to the actions of acids are A. Enamel cuticles, B. Enamel lamellae, C. Enamel rods, D. Interprismatic substance of enamel, E. Ameloblast. Option A is correct. Enamel cuticle. 7. The most common route by which infection may reach the pulp is through A. The bloodstream, B. Traumatic injuries, C. Dental caries, D. Erosion, E. Periosteum. Option C is correct. Dental caries. 8. The cells responsible for root resorption are A. Fibroblasts, B. Cementoblasts, C. Osteoblasts, D. Osteoclasts, E. Odontoblast. Option D is correct. Osteoclasts. 9. Dry socket is a form of A. Osteomyelitis, B. Osteitis, C. Osteoma, D. Periostitis, E. Granuloma. Option D is correct. Periostitis. 10. Inflammation of the lips is referred to as A. Stomatitis, B. Glossitis migraine, C. Cheilitis, D. Vincent angina, E. Siladenitis. Option C is correct. Cheilitis. 11. Dens in denti occurs most commonly in the A. Maxillary canines, B. Mandibular premolars, C. Mandibular second molars, D. Maxillary lateral incisors, E. All incisors. Option D is correct. Maxillary lateral incisors. 12. Paralysis of the tongue is referred to as A. Ankyloglossia, B. Glossoplegia, C. Macroglossia, D. Pyroglossia, E. Geographic tongue. Option B is correct. Glossoplegia. 13. An abnormal disease in the flow of saliva is called A. Dilism, B. Trismus, C. Xerostomia, D. Salivation, E. Siladenitis. Option C is correct. Xerostomia. 14. The cells most frequently found in a granuloma are A. Mast cells, B. Giant cells, C. Lymphocytes, D. Neutrophils, E. RBCs. Option C is correct. Lymphocytes. 15. A cyst occurring under the tongue, caused by obstruction of a salivary gland duct, is called A. Follicular cyst, B. Dentigerous cyst, C. Ranular, D. Dermoid cyst, E. Epidermoid cyst. Option C is correct. Ranular. 16. The most common benign tumor occurring in the oral cavity is the A. Papilloma, B. Adenoma, C. Fibroma, D. Hemangioma, E. Lipoma. Option C is correct. Fibroma. 17. The most common malignancy found in the oral cavity is A. Basal cell carcinoma, B. Transitional cell carcinoma, C. Melanoma, D. Squamous cell carcinoma. E. Adenocarcinoma. Option D is correct. Squamous cell carcinoma. 18. The excessive formation of scar tissue is called A. Fibroma. B. Myxoma. C. Keloid. D. Myoma. E. Carcinoma. Option C is correct. Keloid. 19. Failure of the tuberculum impar to retract prior to fusion of the lateral halves of the tongue results in A. Median rhomboid glossitis. B. Cleft, bifid, tongue. C. Geographic tongue. D. Scrotal tongue. E. Sarcoma of tongue. Option A is correct. Median rhomboid glossitis. 20. Atrophy of the pharyngeal and gastric mucosa, koilonychias, spoon nails, and predisposition to oral carcinoma in postmenopausal women are features of A. Iron deficiency anemia. B. Pernicious anemia. C. Sturge-Weber-Demetri syndrome. D. Plummer-Vinson syndrome. E. Trisomy 21. Option D is correct. Plummer-Vinson syndrome. 21. Papillary cystadenoma lymphomatosum, which occurs almost exclusive in the parotid gland, is commonly called A. Cylindroma. B. Pleomorphic adenoma. C. Wadden's tumor. D. Mikulich's disease. E. Jaffe's syndrome. Option C is correct. Wadden's diseases. 22. Anormal clot retraction time, which is independent of coagulation time, is indicative of a normal number of circulating A. platelets. B. lymphocytes. C. monocytes. D. red blood cells. E. neutrophils. Option A is correct. Platelets. 23. The most likely diagnosis in a 23-year-old, mentally alert, male dwarf with disproportionate arm and leg to body growth, prominent forehead, and retruded maxilla is A. cretinism. B. pituitary dwarfism. C. acromegaly. D. achondroplasia. E. Eagle's syndrome. Option D is correct. Achondroplasia. 24. Osteosarcoma characteristically may develop in cases of A. osteopetrosis. B. osteogenesis imperfecta. C. acromegaly. D. osteotus deformans. E. all of above. Option E is correct. All of the above. 25. The blood of a patient with an acute infectious process would be expected to demonstrate A. lymphocytosis. B. leukocytosis. C. monocytosis. D. leukopenia. E. erythrocytosis. Option B is correct. Leukocytosis. 26. A biopsy would be of value in the diagnosis or oral lesions of A. amyloidosis. B. carcinoma in situ. C. tuberculosis. D. lichen planus. E. all of above. Option E is correct. All of above. 27. In an early carious lesions, the first structure to show evidence of destruction is the A. enamel prism. B. cuticle. C. interprismatic substance. D. lamellae. E. dead tracts. Option C is correct. Interprismatic substance. 28. The features of multiple skeletal radiolucencies: reversed Ag ratio, Bence-Jones protein in the urine, and solid plasma cell infiltrate in the biopsy in a 50-year-old man indicate a diagnosis of A. metastatic prostatic carcinoma. B. multiple myeloma. C. hyperparathyroidism. D. miliary tuberculosis. C. basal cell Navi syndrome. Option B is correct. Multiple myeloma. 29. Histiocytosis X, sometimes referred to as non-lipid reticuloendotheliosis, includes A. Letterer disease. B. Hanschüler-Christian disease. C. eosinophilic granuloma. D. histiocytoma. E. all of above. Option E is correct. All of the above. 30. The irradiations to the head region do no cause A. xerostomia. B. osteoradionecrosis. C. radiation carries. D. interference with tooth development. E. Ramsay-Hunt syndrome. Option E is correct. Ramsay-Hunt syndrome. 31. Features of multiple bone radiolucencies: hypercalcemia, hypophosphatemia, and loss of lamina dura and indicative of A. acromegaly. B. Hyperparathyroidism. C. Hypothyroidism. D. Multiple myeloma. E. Osteitis deformans. Option B is correct. Hypoparathyroidism. 32. All the following developmental cysts of the jaws present as radiolucent lesions except A. Median palatal cyst. B. Nasopalatine duct cyst. C. Nasoalveolar. D. Globulomaxillary cyst. E. Epidermoid cyst. Option C is correct. Nasoalveolar. 33. Koplik spots are an early intraoral manifestation of A. Varicella. B. Variola. C. Rubella. D. AIDS. E. Mumps. Option C is correct. Rubella. 34. Vesicles or bullae of the mucous membrane or skin are seen in all the following except A. Herpes simplex. B. Herpes zoster. C. Agranulocytosis. D. Pemphigus. E. SLE. Option C is correct. Agranulocytosis. 35. White lesion of the oral mucosa are characteristic of the following except A. Hyperkeratosis. B. Leukoedema. C. Lichen planus. D. Medium rhomboid glossitis. E. Acanthosis. Option D is correct. Medium rhomboid glossitis. 36. A patient with oral moniliasis that does not respond to nystatin therapy should be evaluated for the following except A. Diabetes insipidus. B. Diabetes mellitus. C. Hyperparathyroidism. D. Malignant lymphoma. E. Raised Ca+ in serum. Option A is correct. Diabetes insipidus. 37. The peak incidence of gingivitis in children occurs at ages A. Birth 6 months. B. 1 to 3 years. Circa 5 to 7 years. D. 7 to 10 years. E. 10 to 13 years. Option E is correct. 10 to 13 years. 38. The classic triad of Hand-Schiller-Christian disease includes lesions of bone, exophthalmos and A. Diabetes insipidus. B. Hepatosplenomegaly. C. Diabetes mellitus. D. Albuminuria. E. Hypothyroidism. Option C is correct. Diabetes insipidus. 39. Oral cytological smears are of no value in the diagnosis of A. Oral cancer. B. Primary intraoral herpes simplex. C. Recurrent intraoral herpes simplex. D. Herpes zoster. E. Lipoma. Option E is correct. Lipoma. 40. The so-called split papule, an erosive lesion involving the commissure of the lips, is actually A. An aphthous ulcer. B. A traumatic ulcer. C. A mucus patch. D. A fever blister. E. Koplik spot. Option C is correct. A mucus patch. 41. The stigmata of congenital syphilis does not include A. Seborrheians. B. Interstitial keratitis. C. Eighth nerve deafness. D. Ragades. E. Cleft lip. Option E is correct. Cleft lip. 42. Intraoral carcinoma cannot present clinically as A. Ulcers. B. Nodule. C. Cauliflower-like growth. D. Growth with fungating margins. E. Abscess. Option E is correct. Abscess. 43. The Melkeson-Rosenthal syndrome is characterized by facial paralysis, cheilitis granulomatosa, and A. Black hairy tongue. B. Scrotal tongue. C. Geographic tongue. D. Bifid tongue. E. White hairy tongue. Option B is correct. Scrotal tongue. 44. The GAN complex is associated with A. Primary of childhood tuberculosis. B. The adrenogenital syndrome. C. Uveoparotid fever or Hereford's syndrome. D. Histiocystosis. E. AIDS. Option A is correct. Primary of childhood tuberculosis. 45. White, interlacing lines, striae of Wickham, on the buccal mucosa are a characteristic clinical feature of A. Leukoplakia. B. Lupus erythematosus. C. Lichen planus. D. Psoriasis. E. Carcinoma in situ. Option C is correct. Lichen planus.